Four things. Let's talk today about dehydration. How many of you drink enough water every day? Good, good. We are in the minority. You know, when it comes to drinking water and dehydration, one of the things I like to do is have my clients, have my patients, they must have water on them going through our sessions. You know, you guys always give you time to drink water. A lot of folks do not drink enough water a day, not even 2 glasses. I did an impromptu survey with my clientele, and a lot of folks, I got varying ranges of answers about why they're not drinking enough water. They ranged all the way from I don't like water to I don't think about it to I'm not thirsty. Does anyone know the first stage of dehydration? It's when you're thirsty. It's when you're thirsty. So when you start cramping, that's going to be about a 48-hour turnaround without any type of medications that may act on dehydration. Things like diuretics. Diuretics will impact your ability to hydrate yourself, obviously. When you see these guys playing sports and they're cramping, they're 48 hours out before they're going to be able to be at a normal, good hydration level. That's why they'll take these guys and try to give them an IV. And a lot of times that's not even good enough to get them back to a normal, healthy hydration level. So let's talk a little bit here. I've got some good information here from PubMed, from the National Council on Aging this morning. Dehydration occurs when you use or lose more fluid than you take in, and your body doesn't have enough water and other fluids to carry out its normal functions. If you don't replace lost fluids, you will get dehydrated. The reason we're talking about this is because dehydration plays a big factor in falls. Older adults naturally have a lower volume of water in their bodies and have conditions or take medications that could increase risk of dehydration. This means even minor illnesses, infections that affect lungs and bladder can result in dehydration. What are the signs of dehydration? Extreme thirst, less frequent urination, dark colored urine, fatigue, dizziness, confusion. It can also impact your orthostatic blood pressure, right? When we go from a seated position and standing, if you've ever felt lightheaded, that's what we call orthostatic blood pressure, right? That's why we instruct people to take your time at night when you're going to the restroom, put your feet on the floor, count to 3, stand up. You want your legs against the bed, right? You'll have your legs against the bed. Count to 3 and then move forward. That gives your blood pressure a chance to regulate. If you're not properly hydrated, this could take a bit longer to occur. So there's a lot of things, guys, on these pages here. I went through several different websites. How much water should we be drinking? Does anyone know? Well, we've all heard we should drink 8 glasses of water per day, right? As it turns out, that claim has no scientific evidence to back it up. So how much water should a senior drink every day? Well, the daily amount of water a senior should drink depends on body weight, age, medication use, what type of medications, and fitness activity levels. A general good rule is to divide your weight in half to calculate daily water intake by ounces. So take your weight, divide it in half, and that number, convert it, just that number, let's say that's the number in ounces of water that you should be drinking, okay? That's a good rule to follow. So for example, if you weigh 100 pounds, right? Most of us are really close to 100 pounds except me, right? I got you. I got you. So you're looking at drinking about 50 ounces of water, okay, which is about 6 1/4 cups, okay? If you're, let's say you're 140 pounds, right, it's about 70 ounces of water, okay? And everybody catching on to how we're doing that? If you weigh 180 pounds, you're drinking 90 ounces of water. 90 ounces of water is going to be about 11.25 cups, okay? So it's important to consider other factors like your activity levels, and just as we age, our total water volume, our ability to hold water lessens. Okay, so keep that in mind too. Dehydration affects 20 to 30% of older adults and has a greater negative outcome in this population and increases mortality, morbidity, and disability. Okay. So guys, I want you to go through the sheets. We're not going to go through here anymore. I'm going to whip through and make sure that everything I had that I wanted to state, I got through. Let's just see here. I think that was it. I usually put a note. Okay. There was a study done when it comes to falls, dehydration and falls. A total of 11,622 of 30,634. So let's just round it up. Let's say a total of 12,000 out of 31,000 patients studied were identified as dehydrated. So that's about 38%. So 38% of these patients were found to be dehydrated. 11% of them, of those, were diagnosed with at least one fall during the follow-up period. 11% died during the follow-up, with 21% having either fallen or died. Does everybody understand that? That's kind of taking everything we've talked about dehydration and giving it to you right there, no sugar coating. These are the impacts of dehydration. One more time. 37% of patients studied were dehydrated. 11% were diagnosed with at least one fall. Another 11.8% died during the follow-up. And 21% had either fallen or died. So this is a study that was done, and these were the results of that study over dehydration in seniors. You guys, it's uploaded on the website. If you're curious about it, go check it out. You can download it and comb through all that fancy stuff. There's a nice graph in there that will show you, a nice chart rather, not a graph, that will show you that information. So, all right, any questions? Nope. Let's get started.